Verizon.
In the back of the book segment tonight, former President George W. Bush is in good spirits this evening following a heart procedure after his doctors found a blockage in his artery during his annual exam. The former president has been a fitness enthusiast big time for years, so why the heart problems? Perhaps it's because he didn't always treat his body like a temple.
I wasn't a role model for a while. I drank too much. I smoked cigarettes. I'd sit around. But people have to make up their own mind. I mean, there's no law you can pass to tell people to get off the couch. But hopefully people, once they start exercising, will realize the physical and mental benefits.
Joining us from New York, Dr. Stephen Reisman, a cardiologist. Okay, doctor, what happened here, do you think? I know we don't know the specifics, but what could have prompted them to put this stent in today?
Well, it seems like he went for his annual physical exam, and at that point, something was done testing-wise, most likely a stress test, is my guess, to show that he had an issue with heart blockage. He was then most likely referred to the hospital for an angiogram. And again, we don't have all the information, but most likely at that point they found a severe or tight blockage of one of the 3 or 4 main coronary arteries supplying the heart, and they put a stent in to increase the blood flow to that area.
Now, how long can you live with a stent before you have to get switched out or some other procedure? He's 67 years old, in top physical shape. I biked with him a couple of times, and he kicked my tail, which was very embarrassing, but he's in incredible shape, incredible athlete, period.
You could live for a very long time with a stent. The only issue with a stent is frequently you need certain types of medication, like blood thinning type of medication, to make sure there's no further clotting, and one has to be on alert for bleeding, either gastrointestinal bleeding or, God forbid, some type of intracerebral hemorrhage if if you have a stroke down the road. So that is one of the downsides of you have to just be careful about.
So you're talking Coumadin or a drug like that, doctor?
Plavix is the most common drug, and there are a lot of newer drugs that are more safe than that are more specific. But certainly that's things that you have to keep aware of as you go down the road.
And doctor, how do you guard against this or pick up the early signs?
Okay.
Because again, he's such an amazing athlete. I mean, his blood pressure, I remember, was always really low when he did the annual exam. So what can we look out for?
So there are 2 things to look. One is to see how you're doing at the present time, and the most common thing that's done is a stress test. The most comprehensive stress test out there is probably a nuclear or thallium stress test. And if you want to predict down the road how you're doing, there's a relatively new test that we've incorporated in our practice called an endopat test. We've used that for 6 months, and that looks at the arterial lining called the endothelium to see if you're at risk for developing plaque in your blood vessels. And one can go to our website, www.newyorkcardiac.com, and learn about that test. And we feel it's a very important early predictor.
So that's better than an echo?
An echocardiogram, as far as blockages, will really only show a problem after you've developed severe blockages.
Oh.
A stress test is far superior to just a resting echocardiogram, and certainly an endopat early on, and obviously blood tests, risk factors, and lifestyle modification, and then exercise, of course, and diet as far as early treatment is very important. How
about the alcohol use that he used to before he was 40? Alcohol and smoking.
I don't think alcohol is playing a big effect here. Depending on how heavy a smoker it was, it may be somewhat of an effect.
Okay. We really appreciate it, Dr. Reisman, and we wish President Bush the very best, and I know he's in good spirits. He's always in good cheer. And finally tonight, a little reminder, please tune in tomorrow for my radio show. You can find listings across the country at lauraingram.com, and also you can become a Laura 365 member. Remember, my podcast launches in the afternoons, about 3 p.m.